Hi everyone, it's Dr. Brandis Montgomery coming to you live from my own home today. I wanted to give you guys some new information. We have looked in the past on the podcast regarding hip pain. We've also talked about some back pain. Today we're going to switch it up and talk about shoulder pain. And I wanted to make sure that we address kind of all the common things that happen with shoulders, the common complaints and pains and diagnoses that you might hear from the doctor. And so today we're going to talk through a few of those and how physical therapy could help you if that's what's best, and also some things that you could do at home to help you. So looking into the shoulder, this is one of probably the most common, aside from back pain, that I treat, and probably 75% of the time it's your bicep tendon that's inflamed from what I've seen. But rotator cuff is also very common, and that diagnosis is actually very common. Sometimes it's not even the rotator cuff that's injured, but you will see that diagnosis a lot. And so we're going to talk through some of those diagnoses and what they mean, and also look at different postural corrections that we can do to help them. So the first thing we're going to address will be a tear and a strain. Let's talk about what those are and what are the differences between them, and then we'll kind of talk through what we can do about them as well. So first of all, a strain or a sprain. A strain has to do with a tendon. So that's our muscles form tendons, and the tendon is what inserts into our bones. So when we're talking about a strain, we're talking about typically an inflamed tendon that can potentially tear, which would be your in range of a strain or a sprain. A sprain involves a ligament. A ligament is what connects one bone to another to form a joint, and that can also sprain or tear as well. So when we're looking at a strain or a sprain, there's usually 3 grades, and once we go from a grade 1, which is mild, we've torn a few of the fibers within the tendon or the ligament, to a grade 3, which can involve a full tear of the tendon or ligament. So when we're dealing with a strain or a sprain, most of the time that's dealt with physical therapy first to see if that helps. And then if you're getting relief and things are progressing well, which typically is the case, then surgery is not indicated. However, there would be cases when surgery would be optimal. For example, if you're trying to get back into a sport quickly and you have a grade 2 to 3 sprain or strain, sometimes they will give surgery as an option because it can be quicker, believe it or not. When we have those larger sprains and strains, they tend to take forever to heal. So it is possible to heal without surgery. They just take a long time, and if you're in a rush trying to get back to your sport, then they may offer that as an option. But surgery is almost always indicated in a full tear of the tendon or ligament because we want to reattach that section back to the bone so that you have full use of it again. However, one thing that people don't realize is that when we sprain a ligament, our ligament, in a sense, will never be the same again. So when we stretched and pulled on a ligament that attaches from one bone to the neck, that ligament will always be somewhat stretched out. So our ligaments are not able to kind of go back to their normal state again after they've been pulled on or sprained. And in that case, the physical therapy options that we have are doing tons of stabilization exercises to provide the muscles supporting around a joint. So now instead of a ligament doing most of the work, our muscles will help us to provide stability around the joint. And it's not that the ligaments are no longer helpful at all. They're still there. They're still helpful, especially at your end ranges. But they may just not be as tight as they used to be. And so we have to recruit other ideas to help us. So that's what a lot of your physical therapy is focused on. Dealing with a sprain or a strain and finding really good postural correction, really good stability. If we're going to talk about our shoulder, of course, then we want to look at how can we put our shoulder in an optimal position to provide stability and strength when we are doing different moves throughout our day. And those are the things that we would be teaching, along with general strengthening and range of motion. If you do end up having a full tear and surgery is recommended, then a tear or a in-grade sprain or strain would include going into the shoulder. It's usually through a small scope, so you don't have large incisions. And they will take the tear from the one side of the bone or muscle and attach it back to the bone using some anchors. And then you do physical therapy after to regain your range of motion and strength. And usually it's very successful. People seem to get back to normal pretty well. You might be in physical therapy for a few months depending on your progress, but you don't have a ton of limitations, just a few, and then we progress through those back to normal strengthening, stabilization, postural training, and things like that. So rehab isn't terrible. Of course, it's painful initially because you've just had surgery, but once the surgical part starts to heal, it's normally just getting your range of motion normal as quick as we can. So surgery is not a terrible thing. Next, we're going to look at the labrum. A lot of people come to me and they say, I have a labral tear. I'm like, what do I do? Well, labral tears can be very frustrating, but they can also be very much lived with. So a little anatomy for you for what a labrum is. We have, for the most part, 2 of them, one in our shoulder, which sits kind of like this inside of our shoulder, and same idea inside of our hip joint. Both of those joints are called a ball and socket joint, which means our arm bone can move in all directions. We can move our arm in a circle, we can move it forward, backward, round and round. Same thing with our hip. We can move our leg around, we can move it forward, back, side to side. It goes in all the plane, and which is fantastic for mobility. It gives us lots of options for what we can do, but we have an increased risk of tearing. All the labrum is sort of like a cushion that protects this bone. So our shoulder, that's our shoulder blade or our scapula, and our arm bone, which sits up here in it. So we move our arm bone all around, and we don't want our arm bone to be pressing on the bone inside here. So we have a labrum that sits there, and it protects bone pushing on bone. Sometimes though, that little labrum can get a tear in it, and it gets in our way. Sometimes we complain of it feeling stuck, like we have to adjust our shoulder a lot to try to get it out of the way. It can click, can be painful with motion. And in the shoulder, our bicep tendon, which comes from our bicep muscle here, our bicep tendon goes up inside our shoulder joint and it attaches to the front of the labrum. So sometimes you can get a tear to your bicep tendon as well as a labral tear, and this is called a slap tear. So that's a very common diagnosis. You can hear that a lot, and you may get diagnosed with a slap tear and they recommend physical therapy. Let's see what happens. Or they'll say surgery to repair the slap tear. Again, slap tears are easy to take care of. It's not a terrible rehab with your physical therapy. Range of motion is the most important right out of the gate, and then progressing to more stability exercises to prevent further damage to the forward. So not something to be scared of. A lot of people live with labral tears all the time. There are lots and lots and lots of undiagnosed labral tears, so you can function with them, and as long as they're not flared up, they don't bother you. It's kind of like a meniscus tear. Yeah, they can be annoying, they can bother you, they can be very painful, but if you know the things that bother them and you stay away from those things, or you strengthen and stabilize to prevent any pressure on, you can mostly get through life without having to have surgery done on a tear. All right. Lastly, we're going to talk about the old rotator cuff. The rotator cuff is probably the most diagnosed part of the shoulder. However, I've found in my 15 years of practice that a lot of times it is misdiagnosed. Or, yeah, maybe the rotator cuff is a little bit of the problem, but everyone's complaint is here in the front of their shoulder, and that tends to be the bicep tendon flared up. So more commonly, I end up treating bicep tendons even when it's recommending a diagnosis of a rotator cuff, because rotator cuff is typically like a side note, like bicep is the real issue, this is where all my pain is, this is where all my problems are, but now my rotator cuff is starting to hurt too because it's gotten flared up from my dysfunction. So quickly for you, the rotator cuff consists of 4 muscles, and these muscles attach to our shoulder blade back here, both on this side of it and the underneath side. We have one as well, and they come around and attach to our shoulder, and of course the one underneath attached from the underneath side. And what they do is provide rotation of our shoulder. So they help us throw, they help us to reach for things behind us, as well as assisting with lots of other motions. They assist with reaching and coming behind our body. Lots of motions. So they're always involved, and there's a very small space that goes underneath of our shoulder blade right here. This is called our acromion, this bone, and our rotator cuff tendons come underneath of that guy where they attach, and there's just not a lot of room for them. And most of us have not good posture these days, and so we end up putting pressure and decreasing the amount of space that they have there. We can also get rotator cuff issues from overuse of those muscles, and they're not prepared for that type of activity. So if you're a throwing or an overhead athlete and your shoulder is not either strengthened or have the endurance to help you with that much volume, or you put your shoulder in a hazardous position in order to accommodate for lack of range of motion, lack of strength, lack of endurance, and we end up straining those muscles over time. So with rotator cuff, almost always, unless it's a full tear, we will do physical therapy first before there's surgery involved. And people can get a ton of success with rotator cuff and bicep tendon inflammation, even partial tears. You can get a lot of good return to function with physical therapy. We, of course, work first on range of motion because if your range of motion is lacking, working and then we strengthen the muscles around it, it will be much harder to gain your end ranges of motion. The range of motion is most important. We try to get that as quickly as possible back to normal. And then, of course, working on your strength and stabilization muscles to help prevent strain back to those little tendons. So the biggest part of this is knowing what our posture should look like as we're doing different things. When I am up in an overhead position, can I get my shoulder blades out of the way and back in their home base back here so that when I'm overhead, I'm not putting strain on them? And that's pretty much key. If you can nail that down, that will save you a lot of problems going forward for the poor little rotator cuffs, and then you'll have a lot more strength as well and velocity throwing if you're. So keep in mind that physical therapy is a great option for shoulder pain, strain, all the things. And I would almost always recommend someone start with physical therapy first if they're having shoulder pain, and to get physical therapy when you first start having pain, not waiting until it's interfering with every aspect of your life. The quicker that you start getting physical therapy, the quicker it is to get you ahead of the pain and help you going forward so that you're not having issues. If you wait until it's affected with sleep, it's affected with reaching, it's affected with your normal activities of daily living, and it takes a little longer to get ahead of that pain and then help you prevent it from coming back. So that path is a little bit of a longer one. So keep that in mind. If you're having shoulder pain, if you are limited in your sport with your shoulder, if you're an overhead athlete, you need to reach out to physical therapy quickly so that we can start working on those things immediately. That way you can get ahead of it and continue playing and it won't disrupt what you're doing. If it's to the point where like any motion, any activity is bothering you, I would recommend you take a break from your sport so that your shoulder gets time to heal first, and then you can return once you've figured it all out and learned all the things from us. So if you're having shoulder pain, if you have issues that are limiting your daily function or your sport, you of course always reach out at On the Move Massage and Physical Therapy, and we can always do a free phone consultation to figure out if physical therapy is something that's best for your shoulder or if you would benefit from something else. So reach out, let us know, and we want to help. Have a great day.